am Dr. Suvarchala, Scientific Director with Ziva Fertility Centers. Ovulatory disturbances or problems associated with the release of eggs are the most common cause of infertility. They have been explored, a lot of work has been done, and a number of tests and investigations are now available to come to a conclusion that this is the problem you are suffering for, which is causing infertility in the couple. A number of causes can be related to ovulatory disturbances. Let us talk about a few. The first is PCOS or polycystic ovarian disorder. PCOS causes a hormone imbalance which affects ovulation. PCOS is associated with insulin resistance and obesity. Abnormal hair growth on the body or face is also seen, and there's a lot of acne also associated. In such patients, the ovulation of the egg from the ovaries is infrequent or very far from each other. Therefore, planning for pregnancy becomes a very big issue. PCOS is a very common cause within ovulatory disturbances. Next is hypothalamus pituitary disorders or dysfunction. Two hormones produced by the pituitary gland are responsible for stimulating ovulation each month: follicle stimulating hormone and luteinizing hormone. Excess physical or emotional stress, a very high or very low body weight, or a recent substantial weight gain or weight loss can disrupt production of these hormones and affect ovulation. Irregular or absent periods are also the most common signs of this kind of an issue. That is, your periods can be irregular or they can be absent totally. So absent periods are called as amenorrhea. We've covered that in a previous topic. So these are a very common symptom of hypothalamus pituitary disorder. The next is primary ovarian insufficiency, also called as premature ovarian failure. This is usually caused by an autoimmune response or by premature loss of eggs from your ovary, possibly as a result of genetics or chemotherapy. The ovary is no longer producing eggs and it lowers estrogen production in the ovaries. It can happen under the age of 40 also. This is not normal. Usually it's close to menopause that a woman undergoes ovarian insufficiency. But if it is premature, if it is under the age of 40, it is called as premature ovarian failure. Next is too much prolactin. The pituitary gland can cause excess production of prolactin, or it's also called as hyperprolactinemia, which reduces estrogen production and can cause infertility. This can also be caused by medications you are taking for other conditions. So this is a very important factor as well. Hyperprolactinemia causes an imbalance, and therefore FSH and LH are also not produced sufficiently for ovulation of eggs. Therefore, it's very difficult for you to understand when to plan for pregnancy. So the four factors that I have mentioned are the most important disorders associated with ovulatory problems. And the signs and symptoms are very simple. If the periods are too far in between, and if you have too much hair, too much acne, you've put on too much weight, you've been diagnosed as insulin resistant, or you have hyperprolactinemia or discharge from the breast, even if you're not pregnant. So these are the causes of ovulatory disturbances. If you want to understand more about this, please feel free to call us. Thank you. A lot of effort has gone into making this video. Please like and subscribe us. Thank you.